Assalamu alaikum, Amina. How are you and little Adam today?
Wa alaikum assalam, doctor. I'm so worried. He isn't feeding. His breathing, it's just so fast.
You did the right thing bringing him. Trusting your instinct is your strength. Let's talk about what is happening. Absolutely not. It is not your fault.
Yeah.
This is a common test from Allah.
Yeah.
Our role is to seek the cure. We watch these numbers very closely. We must know if his breathing stops or if his lips begin to look blue.
Of course, never underestimate prayer. The Prophet ﷺ taught us to seek cure.
Right.
Your faith and your care are his strength.
Welcome to the deep dive. Today, we're looking at something really quite specialized. It's a communication guide, but structured as a video script. And it's designed for a very specific audience, Muslim mothers whose babies are in the hospital with bronchiolitis. Our mission today is to sort of explore how this guide manages to translate some pretty complex pediatric medicine into a narrative that's not just clear, but also deeply compassionate and culturally supportive.
Right. It's quite remarkable, really. It steps away from just, listing symptoms and treatments. It weaves the clinical facts into this supportive story that also acknowledges the mother's spiritual and emotional needs.
Yeah, and you feel that straight away. The opening line, it's not medical at all. It validates the mother's intuition right from the get-go. It says something like, as a mother, you know your baby's every sound. When something is wrong, your heart feels it first. That immediately changes the whole dynamic, doesn't it? It's not just, here's information, it's, we see you, we understand.
Exactly. It's a masterful way to frame it. Because think about it, the panic, the potential for self-blame, those are huge barriers. So the real aim here is to empower the mother, Amina, in the scripts example, make her feel like a vital part of the team caring for her baby, Adam. And they do that by addressing everything. The clinical side, sure, but also her emotional state, her spiritual grounding.
Okay, so let's unpack the clinical explanation first. Bronchiolitis. It's that common, often RSV-driven respiratory illness in babies, especially in winter. The script has this pediatrician, Dr. Yusuf Ali, explaining what's actually happening inside the baby's chest. How does he make that clear without getting too technical?
He uses analogies, really clear, simple ones. He asks Amina to picture the baby's tiny airways, the bronchioles, as small branches on a tree. It's an image everyone gets. Then he explains that a common virus, nothing she did wrong, has made those little branches swell up and get filled with mucus. Sticky mucus.
And the impact of that blockage. The analogy he uses for the difficulty breathing is incredibly powerful. He says it's like a little fish trying to breathe through a narrow straw.
That just hits you, doesn't it? It conveys the struggle, the desperation immediately. You understand how serious it feels without needing charts or numbers.
Right. And it probably helps it stick in the mind even when you're stressed.
Absolutely. But then, almost immediately after explaining what it is, the script moves straight to, well, psychological first aid, really. Bronchiolitis is super common, especially if there are older siblings bringing viruses home from school or nursery. But parents always wonder, did I do something?
The guilt factor.
Yes, and Dr. Ali tackles that head on. He gives Amina two really explicit reassurances. First, absolutely not. This is a very common infection. It is not your fault. Just point blank.
That's so important. And the second one?
He also tackles that common myth, He explicitly says it is not caused by cold weather. Even though it's more common in winter, it's the virus, not the temperature itself. So stop thinking, I should have put another blanket on him.
Yeah, that takes a huge weight off, I imagine. It lets the parent focus on the actual situation, not on self-blame.
And this is where it gets really interesting, where the cultural competence shines.
Yeah.
Right after dealing with the clinical facts and the guilt, he brings in faith. The illness isn't presented as just a random bad thing or a failure. It's framed as a test from Allah.
Okay.
And their role, the family's role, the medical team's role, is defined as seeking the cure with trust in Him. So it shifts the whole emotional landscape from anxiety and blame towards, well, active patience and trust in a larger plan.
That's quite a profound shift. It gives a different kind of agency, maybe, a spiritual one alongside the medical reality. But okay, moving to the treatment. Dr. Ali is very clear. There's no magic medicine here.
Right. Setting realistic expectations. This virus just has to run its course. The body's immune system has to fight it. So the entire medical approach is about supportive care. Our job, the hospital's job, is just to support the baby's body while it does the hard work of healing.
And the source material outlines 4 key pillars of this supportive care. Let's quickly go through them. First, oxygen support, often given through those little tubes in the nose, the nasal cannula.
Just to keep the oxygen saturation levels up. That's described as the top priority.
Okay. Second, hydration and nutrition, keeping the baby hydrated. This might mean an IV drip or sometimes a nasogastric tube, that little tube through the nose down to the stomach.
Exactly. Because breathing takes so much energy, babies often can't feed effectively by mouth.
Which leads to the third pillar, something the mother can actively help with: nasal suction. They show her how to use saline drops and a bulb syringe to clear the baby's nose, especially before trying to feed or settling for sleep.
Yeah, that's crucial because babies really need clear noses to breathe comfortably. And the fourth pillar, this one can be tough for parents: minimal handling.
Right. The instinct is to hold and comfort your sick baby constantly.
Of course. But the script explains that too much stimulation, even cuddling or playing, can actually make the breathing work harder. It increases their oxygen needs. So letting the baby rest quietly as much as possible is actually a key part of the treatment.
That's counterintuitive, but makes sense. Now, you mentioned the feeding tube earlier. That seems like a really sensitive point.
Oh, absolutely. For any mother, but perhaps especially one who intended to breastfeed, the idea of a feeding tube can feel like a failure.
A failure on her part.
Yes. And the guide anticipates this completely. The script uses very deliberate language. Dr. Ali tells Amina, it's not a failure in your breastfeeding. He normalizes it.
How does he frame it instead?
He reframes it entirely as a temporary necessity because the baby is simply too tired to feed. The tube isn't replacing her. It's helping the baby save his energy for breathing. It's presented as an aid, a support mechanism, not a replacement for her role.
And they make sure to mention her breast milk can still be given through the tube, right?
Yes, reinforcing that her milk is still the ideal nutrition. And crucially, they elevate her non-medical contributions. Her presence, her touch, her voice. These are described as the most powerful medicines. That's a direct quote.
Wow, that's really validating. It acknowledges her unique role beyond the physical feeding.
It connects that sort of, attachment science with the emotional and maybe even spiritual comfort she provides. She is essential, even with all the medical tech around.
Which brings us nicely to the spiritual aspect. Amina actually asks about this in the script, doesn't she? She asks Dr. Ali, can I make dua for him? Is there anything from the Sunnah?
She does. And his response is immediate and positive. No awkwardness, no dismissal. He encourages her, saying something like, never underestimate the power of dua, of prayer.
That seamless integration is key, isn't it? Moving from oxygen levels to prayer without missing a beat.
Totally. And he doesn't just say, yes, pray. He gives specific recommendations, drawing from the Sunnah, the practices of the Prophet Muhammad. He suggests reciting Surah Al-Fatiha, that's the opening chapter of the Quran, foundational for seeking blessings and healing.
And he also recommends the Mu'awwidhat. Can you remind us what those are?
Sure. Those are the last 3 short chapters, or surahs, of the Quran. Al-Ikhlas, Al-Falaq, and An-Nas. They're often called the verses of refuge or protection. Reciting them is a traditional practice to seek Allah's protection from harm, illness, evil eye, essentially, all kinds of negative influences.
So it gives her very concrete actions, a specific spiritual toolkit rooted in her tradition.
Exactly. It's not just vague hope, it's actionable faith. And there are physical actions suggested too, like gently blowing over the child after reciting the verses or rubbing the hand over the baby's chest.
Starting the whole process by saying Bismillah in the name of God 3 times.
Yes. It's a complete package integrating belief and practice right into the bedside care plan. The mother feels seen, understood, and supported in her whole identity.
If you step back and look at this interaction, it feels like a model for patient communication, doesn't it? Especially in diverse settings.
Absolutely. By weaving the cultural and spiritual needs so naturally into the clinical conversation, they build immense trust. And that trust, we know, leads to better adherence to the medical advice, reduced anxiety, potentially better outcomes overall.
But even with all this comfort and support, they don't shy away from the serious medical realities. The guide still has to include the warning signs.
Or sure. Clinical safety first. Dr. Ali clearly reviews the red flags Amina absolutely must report immediately. Things like the baby stopping breathing, even for a short time, lips or skin turning bluish, or the baby becoming really floppy, limp, unresponsive.
So the spiritual support complements but doesn't replace vigilant medical observation.
Precisely. It's both hand, not either. Trust in Allah and watch the oxygen saturation monitor.
Okay, so looking towards the end of the guide, the recovery process, how is that presented?
With cautious optimism, I'd say. They acknowledge it's a tough journey. They don't sugarcoat that it's hard work for the baby and stressful for the parents, but they reassure Amina that most babies, the vast majority, do recover fully.
Do they give a timeline? Because parents always want to know how long.
They do manage expectations, typically 5 to 7 days for the worst part of the illness. But they're also careful to mention that the cough, that lingering cough, might stick around for another week or maybe even 2 weeks after they go home.
That's good information to have, prevents worry later if the cough doesn't vanish immediately. And the final message. What's the ultimate takeaway for Amina?
It comes back to empowerment. The closing line is powerful. You are your baby's greatest advocate. It reinforces her role, her importance, her agency in the whole process. She's not passive, she's central.
A powerful affirmation.
And that idea is beautifully tied up with the final quote from the Quran, Surah Ash-Shu'ara, verse 80. And when I am ill, it is He who cures me. It brings together that human advocacy and reliance on divine will, a very balanced conclusion.
So reflecting on this whole source, this video script guide, what does it really teach us, the learners looking at it? It feels like it's so much more than just how to manage bronchiolitis.
Oh, absolutely. It's a masterclass in communication.
Yeah.
In empathy. It demonstrates profoundly how acknowledging the whole person, their fears, their culture, their faith, isn't just nice to have. It's fundamental to effective healthcare. It leads to better partnership, better care.
The power really seems to lie in that seamless blend, doesn't it? Clinical excellence and spiritual comfort, working hand in hand.
Exactly. They didn't treat the mother's faith as an add-on or an obstacle. They treated it as a core part of her resilience, a resource to be actively supported alongside the medical treatment.
Yeah, we saw how that specific cultural and religious context was used as a vital tool. It helped empower this parent who is facing, immense stress and probably information overload in that hospital setting.
Which leads us to perhaps a final thought for you, our listeners, to mull over. We've seen how this highly specific, deeply personalized, holistic approach works so well in an acute, high-stress situation like pediatric hospitalization. So the question becomes, how could we take the principles of this deep-dive communication strategy, this blending of science, with cultural, spiritual, or personal affirmation, and apply them more effectively elsewhere? Think about complex, long-term challenges. Chronic disease management, perhaps? Or mental health support? How might that kind of truly integrated, respectful communication increase engagement and improve long-term healing in those areas?
Something definitely worth pondering. How do we make healthcare communication truly holistic across the board? That's a great question to leave us with.